make sure that you have clothes on, everything is okay with you, because we don't want to inconvenience anyone. As we all know, we are in the age of technology, and people sometimes get embarrassed by it. So please be careful of your background. I think our presenter today will introduce himself because we don't have any formal introduction of him. So we are very sorry for that, but it's not a problem. So, Paul Kennedy, you are welcome. We are very glad to have you with us. We have young people from different parts of the world, from Africa, from Kenya, from Ghana, from Nigeria. We have people from Palestine, from Sudan. We have majority from Liberia. And we also have me, a Liberian living in Turkey. So thank you for being with us.
Thank you very much. Can you all hear me?
I can hear you. I'm sure they can too.
Yes,
yeah,
yes.
I want to be as audible as possible.
Yes, I'm hearing you clear.
Okay, very good. If I have the opportunity to speak now, I will begin first by extending my utmost gratitude to the organizers of this forum. You know, a lot of time on earth in various places, young people are overlooked and forgotten. So to stage a forum that encourages their career participation and they are, building their capacity to want to pursue certain career path, I am very humbled to be a part of that process. The second thing I will be very grateful is to Dr. Nathaniel T. Blama for sharing me the opportunity to be on this forum. Dr. Nathaniel Blama is an extraordinary Liberian. He has served the country in several capacities, including the recent capacity of the Director of Environmental Protection Agency in our country. So I am always humble and very pleased when I am asked by Dr. Blama to conduct any particular task. I, had this impromptu request to represent Dr. Blama. So let me do a disclaimer. I am not Dr. Blama. So you might not be hearing, getting the kind of eloquence and articulation Dr. Blama has. I am Paul Kennedy in my own state. I will try at most possible to present myself such that the subject matter for which I am representing Dr. Blama will be well taken by our listening audience. So just to give a little of myself, my background is in, my career background is in public health, clinical medicine, environmental management, and health system strengthening. I started this career joining about 15 years now. I got a degree in health system management from Howard University in Washington, D.C. That was my bachelor degree. I further pursued a physician assistant degree in clinical medicine from Howard University as a master level. I acquired another master's degree in public health from Wharton University in the United States. I am currently a student pursuing a PhD in epidemiology from Wharton University. So I am not a doctorate degree holder yet. So to follow in the footsteps of Dr. Blama may be something difficult for me to do, but I will try my utmost best, to present to you. I have been serving in public health now for the past 10 to 12 years as a career public health professional. Prior to my relocation to Liberia, I worked with the Department of Health and Human Services in Washington, D.C. as the Director for Preventive Health Services. In 2016, I relocated to Liberia to work with the Millennium Challenge account as the Director for Health, Environmental, and Social Performance for a $250 million grant that was given to Liberian government by the United States Millennium Challenge Corporation. So, that was just a little of my background. I am a public health career person. I currently serve in a consultancy capacity as the health system strengthening and policy advisor to the National Public Health Institute in Liberia. So we are currently challenged with the COVID pandemic, as you may all be aware. And I am one of the incident managers working along with the National Public Health Institute and the Ministry of Health into addressing and trying to bring a crop to the COVID pandemic in our country. But with all of those facts, I was very glad when I heard that I was selected by Dr. Blama to come instead of him to do this presentation to you all. So thank you all very much for having me, and I will be looking forward to joining you with my presentation.
Well, thank you very much. I don't know how to express my gratitude. Seriously, I'm very much happy to have had someone like you, like from the Public Health Institute of Liberia. As you know, we are Public Health Foundation of Liberia, a newly formed non-profit organization by a group of young people from Liberia. So we are very glad to have you here, sir. And we are hungry for the knowledge you have to share with us. Thank you for joining us.
Thank you. So if I may begin now, I will begin by trying to upload my presentation from the desktop. Just to give a clear disclaimer, we are sitting in Liberia, so we have challenges with internet and electricity. So at any point in time, please, forgive my pardon if the LEC, which is the Liberian Electricity Corporation, if it runs out, I will definitely be running to start up my generator. But I hope that is not the case. So I'm in the process of sharing. Do you all see the presentation from where it is seen?
Yeah, yes, I'm seeing it.
Yes,
All right,
yes,
so
yes. Environmental health in Africa. Yeah.
All right, so I'm trying to.
Yeah.
Okay, so the next step for me would be to put it in the presentation mode.
Sure.
I think I was successful in doing that. Do you all see it now on the wide screen?
Yes.
Yes, yes. It's very clear. Yeah. The screen have been shared. We've seen it, sir.
Very good. All right. So, as I said, I'm very grateful to be a part of this great initiative today, trying to, provide the little information I have based on my professional background on environmental health and its, significance as it relates to African youth. According to the United Nations, by the year 2070, a bulk of the world population would be in Africa. We are currently talking now of additional 1.3 billion to the current 1.1 to 1.2 billion we have. So by 2070, we'll be talking about Africa with a population of 2.4 billion. With such dramatic increase in population, I can guarantee you that every sector on our continent, including public health, environmental health, economic and social cultural factors will all be somehow impacted. So it is only good that at this time, you all who are the youthful population that we anticipate will be the next African leaders to begin to take a keen look at the relevant issues that will be confronting you when some of us will no longer be around. So it is upon that background that I decided to outline the presentation you see here. We'll do a little introduction of the issues of public health and environmental health issues. And then we'll see the overview of environmental health issues. We will discuss the impact of environmental health on the African economy. And then we will talk about environmental health opportunities for young Africans. On the preceding slides, you will see recommendations and solutions that have been evidence-based and proven by scholars around the world in recommending that Africans and particularly African youth considers. And then I will be opening up for questions and answers that will come from all of you who are listening today. Thank you all very much for the opportunity that you have given me. Environmental health, as you all know, is the issue of how the environment affects our human health. 100 years ago, there was very limited offspring of biochemical, biological, biophysical pandemics and epidemics flowing around. Don't get me wrong, there were a couple like the bubonic plague and some constraints that actually affected the human health system. But over the past millennium, and couple of centuries, environmental health has been a big issue from the United Nations perspective, which even give rise to a particular agency that is solely responsible for environmental health, because your health depends on the environment around you, pretty much. And the environmental health is the study of the environment. Is a branch of science that actually focuses on our relationship as human beings to the environment where we live. There have been several challenges with environmental health, and scientists would like to study what happened to people and what actually draws back to what catches them as far as within the environment they live. So it only makes sense for young professional, career ambitious people to also begin to take a keen look at how the environment play into our well-being and our existence. Protecting our public and our citizens and our residents from the environment entails a lot of things. From constructing of their homes to even processing of food. Those are procedures that take on a lot of chemical change, hazardous agents, and a lot of environmental health risks that may even be to the extent have pathological or chemical effects. So in the process of learning about our environment, it is difficult for us to detach from our everyday living. When we were growing up, we saw that most of our ancestors or even predecessors, folks before us, walk all around to many places. Now we have encamped most of our lives and our living responsibilities on the mechanical way of being, motor vehicles, airplanes, motorboats. All of those processes are highly engaged into burning of fossil fuels and chemicals. I mean, of course, if you are building roads, you see that building roads will have a lot of things to do with chemical mixture. The asphalt itself is a chemical, and you have a lot of environmental hazard and coming on from radiation perspective to all the biological agents that will all come in play, whether in the future or in the present, to affect the human well-being from a physical, psychological, and social cultural perspective. So environmental health is a very key component of how we as humans live and thrive in our community. I mean, if you have a polluted environment with other chemicals that are used to produce and to even process the food we eat, it could be toxic and could lead to, if not epidemic, pandemic that we are currently experiencing around the country, various countries. So environmental issues, as you all know, should be key factors into how we as human beings continue to move forward. There's a list of issues that are confronting us, and we'll just, if you look on the left-hand side of my slide, you see listing them down from the scarcity of water to climate change, to overpopulation, for deforestation, water pollution. These are all key components that determine our daily future and fate as far as environmental health is concerned. You know, so environmental health issues cover a lot of wide, diverse issues of well-being and current daily attention in our community. Water scarcity, for instance, water scarcity could lead to a lot of environmental challenges. Most places where you have water scarcity, people tend to drink unpurified water. Unpurified water will lead to a lot of, pathogenic or disease condition, from diarrhea to, malaria and other things. So what we as public health professionals have tend to do is to, just as food security, begin to look into opportunities that will bring investment and public health direction into water protection and water security. In fact, the United Nations has established conferences now on water management in the world. For those of us who live in Liberia, though, we take water for granted because Liberia has one of the highest average rainfall in the world. So for 6 months, we have water all over the place. In fact, our fear is that it does not overproduce to become flood or other, disastrous processes for us. So water scarcity may not be an issue for us. We got surface water, we got enough groundwater, we got, stream and all kinds of water running around here. But water scarcity, are challenging for countries north of the Sahara. If you all are familiar with the Arab belt from Algeria, Mauritania, up going to Libya and other places in Sudan, East Africa, and some part of Northwest Africa, we, have heard a lot of the challenges that people are facing there in water. And in fact, it's predicted that the issue of water will reach its heights by 2025. It is estimated that about 2/3 of the world population, including, most of those incidences in Africa, may suffer freshwater shortages by 2025. If we are in 2021, we are talking about anywhere between 2 to 3, maybe 4 years from now. So the issue of water shortage should be highly marked and something that scientists and public health professionals should begin to work towards, so that we do not allow it to catch us unaware. The second issue that is a big issue around the world is the issue of climate change. So climate change has increased over the past decade from how we are doing things. I live in Washington, D.C. for half of my years of life. And Washington, D.C. is about 10 to 12 square miles in city limit as far as location, geographic mapping is concerned. It has about 600,000 people, a little over 600,000. But Washington, D.C. every day sees over 4 million cars in and out of that city. For a small city of such nature, to see 4 million cars coming in and out, I mean, permanently, in future, they're going to face a lot of challenges as far as ozone level pollution and air control pollution, and which could affect their climate change, viability. So, same case in Africa, we've seen increasingly changing industrialization of some African countries now, which is also contributing to the climate change risk, which is going to affect our agriculture production, the issue of our food security, our water resources, and even to the extent of affecting our ecosystems, which our future generation could maybe have to depend on for sustainability and food. So not to overlook climate change is something that we as public health professionals are putting high up on our radar. In fact, the United States government and the G7 countries have rating climate change as the #1 priority item that they are going to begin to fund in underdeveloped countries so that can help them to keep their eyes as far as healthcare is concerned towards the issues. Overpopulation, what I'm calling population growth, is an issue also. Whenever you have a group or particular nation that is just growing in size without the ability to be able to manage the population of size of citizens or people it's having, it bears strains on the natural and economic resources that country has. For instance, Africa now, we're talking about 1.1 to 1.3 billion people. The statistic is that by 2050, Africa is looking to be controlling a population of 2.4 billion. To have 2.4 billion means there are going to be a lot of strains on the already limited resources we have as Africans. So it bears us to begin to look outside of the box, to think outside of the box, to say in preparation for the population growth that is going to impound on our population density, which is going to have some effect, likely effect on our resources as far as our human capacity and the maximum capacity we can be able to carry as a country or as a continent. So, bearing in mind that overpopulation, climate change, and water scarcity are all issues that we, as public health professionals and scientists, should begin now to think of how those issues could be addressed. And the most scary part is for you young people, when we leave this planet, we're going to leave it on the shoulders of most of you. So getting prepared to fight the battles that we began will be your ultimate responsibility. So I'm really glad again that you are all part of this forum and this deliberation. And please stop me anytime during my presentation if you have a question, or if in the interest of time you could write your questions down for us to continue. That will also be a good thing. Deforestation has become a major factor into what our public health challenges are in Africa. For instance, now we see that most of North Africa really does not have forest. Our most dense forests on the African continent are spread down in West Africa. Liberia being amongst those countries as one of the second largest countries in the world to have a really dense forest ratio, over 4 million square acres of dense forest that we've not been able to even access to. But Liberia is just blessed to have those resources. The question to us on this forum is, how are those resources, especially the forest resource, being managed? Are we replanting trees when the trees are cut? Do we have a reforestation protocol in place into our various forest development agency or the forest authority to ensure that we do not deplete our outstanding forest? Because when you deplete the forest, it wipes out and affect the ecological balance of the country and for the continent entirely. We see that forest depletion brings challenges in our agriculture sector. Many of us go to make farm, and the kind of farming that we practice in Liberia is actually also contributory to the kind of forest that we are depleting. Somebody gets up to make a farm. The process in Liberia would be to go and slice the forest down and burn it out to ashes, plant your food. Once that food is harvested, you move to a next dense forest and repeat the entire process. Continuing to do that, if it is on a large market scale, I can almost tell you we'll be depleting Liberia's forest, and such practice is also in some African countries. And we as public health professionals need to hold a conversation on how do we begin now to look at protecting the forest line so that we don't run into the issue of forest degradation or forest deforestation, because that affects our climate change. It produces less rainforest. It makes us to have a diverse condition leading all around, including soil loss, which could run into the issue of erosion and other and natural disaster stuff that comes around in other countries that may not have the resources we have. So it is always good for us to continue to protect our forests and to do the best we can into managing it so that we use it as a given resources, but also make it replenishable so that in the future we can always have it for protection and for economic benefits. Water pollution has been a challenge amongst Africa's problem. Most of our waters are polluted by all kinds of processes. We have artisanal mining going on in most of the mining region area, particularly in Liberia and most African countries that are within mine processing. What happened in that process is there are heavy metals like mercury, lead, and other, that are used to fetch the gold and the diamond or other minerals that have been harvested or pursued by mineral miners. So in the process, our little nice natural creeks, rivers, and streams are all being polluted in the process. If you can see on the left hand of this, and probably that would be your right hand, but on the left hand of my slide, the picture below shows how the waters is also polluted by the very garbage and trash that we use in our daily lives. So the management of solid waste is a challenge into water pollution because most of what we use in our household end up in waterways. So in Africa, because we have a very poor sanitary waste or solid waste management process, it has been a challenge for us to be able to actually manage our water and our riverway because most of our produced garbage are dumped in open fields and some of it by river banks. And the promo result is that it affects the natural fauna and habitat of the riverbed. So our water pollution is coming out from many instances, but particularly from the solid waste that you see lingering around most of our underdeveloped or developing economy. Biodiversity loss is a major challenge also. In most countries, we're seeing deforestation that we just mentioned, but deforestation is affecting the habitat of most of our natural inhabited animals that will need for some protection the covers of those forests. We are cutting down the logs. We are, farming and degrading the biodiversity that could have been used for protection of our tribes and our people. But a lot of the time, we see that to come through the challenges of our lack of protection and maybe lack of systems for most of our countries to be able to actually manage and regulate how we utilize our biodiversity. So our loss of it is endangering the species that we have currently walking around our planet. So it is our purpose to provide little education for our tribes and to see how much we could coordinate what will slash up and burn up on land. Because, just like deforestation, consuming all of our biodiversity and not properly managing them could lead to several things, including earthquakes and other stuff like flood and erosion, and that could undermine our own dwelling into city places. Flooding, most of you have heard the word and probably have even experienced it, is pretty much overlooked, but have all become either the issue relating from climate change that we talk about, deforestation, or biodiversity loss. So if you follow our presentation, you come to find out that most of the issues that are affecting us in public health and environmental management are always almost interrelated. If you do not take care of the trees will lose. And then once the biodiversity have lost, you could resort to erosion, flooding, even air pollution, because the trees, the oxygen that produced by the tree is actually counterparting and giving stages for the CO2 production by most of our industrials and our cars that are running around. Just in recent time, there have been unpredictable amount of floods that wash away parts of Rwanda, according to the research, Kenya, Somalia, Uganda, and other places. We've seen a lot of flood running around Africa, particularly West Africa, where people have lost a lot of their homes, all based off the issue of deforestation and other things that we, could have done probably that we may have overlooked. Air pollution will be, the last on this, and at the end of this slide, maybe I could share it, and then you can use the references at the bottom where you can do further reading and further research on the list of things that are affecting, our environmental health in Africa. But I just wanted to close this section on air pollution, which is the mammoth, concern in Africa. We've seen a lot of gastro emission that have increased, our current air temperature. And folks used to say, well, we had longer days of rainy season, but now the rainy season is not even enough, because that's contributing, the air pollution is contributing to the climate change, which is currently causing a lot of temperature imbalance that is increasing the risk of diseases also amongst us, because air pollution, it's coming out with increased population, and it has shown to affect, the current well-being of all of the folks who are residing in particular areas based on your own country emission and what is doing towards those lines. So we could stay our lines and begin to continue to look out, but it's very important that we focus on managing the airspace we have. Is possible, let's use greenhouse gas, let's reduce greenhouse gas emission as much as possible, so that we can enjoy the space of natural environment and atmospheres we have. So this is just a list of some of the things that we have that impacts our African economy, which is creating a lot of challenges for us in West Africa and the world as a whole. And I keep pushing West Africa because this is where we sit. I'm told that to change the world, you have to change yourself. And we are mostly West Africans. It's only good for us to look in our household to see what are those challenges that we could work on to change before trying to go to Japan to change Japan and China. So you see a list of issues that are impacting our economy, increase in disease burden. Currently, there are pandemics all over West Africa, including the world. Now, if you see how the rest of the world are handling it, as far as resources, it is okay. Africa is handling it though without resources, but the challenge is worse for us into our management of it as compared to other countries' industrial. For instance, you saw China build 2,000, I think 4,000 bed hospital in 2 days. The United States also in New York, the state of New York built a 1,000 bed hospital in 1.5 days. I don't know of any African country that is able to build a 1,000 bed hospital in 1 day. The challenges are enduring to us, and we may not have the resources that the rest of the world has. So it is incumbent upon us as Africans to take preventive or precautionary measures, because I'm told prevention is better than cure. Most of the time when we allow our challenges to befall us, it is very sometimes difficult for us to get out of it. So the environmental health, the impact of it on the African economy, a high cost of disease burden on healthcare spending on our national budget. Most of our national budget are very low caste. Instance, Liberia has a national budget of $580 million. I was joking with one of my friends the other day. $580 million is less than 1/4 of Howard University Library of Health Sciences budget. The Library of Health Sciences at Howard University has a $2 billion budget. So you're talking about a whole country, Liberia, with $580 million budget. I mean, what's the competitive analysis there? So it's good for us low-income countries to begin to look to see how we could use our human skill talents to prevent some of these diseases before they even get to us in the amazing shortage of resources we have. Shortage and depletion of renewable resources, frequent spending on disaster management. We have huge challenges with frequent spending, all because of the impact of environmental health. Most often we have to buy and store off emergency management stuff in the instances where we are challenged with emergencies that may be the cause of disasters from deforestation, flooding, and other things. So it's always good that we as African countries begin to look to draw a scope of operation plans that will manage our public health features so that we are keeping all of these on our alert. High mobility and mortality rates in African countries. Environmental health impact on the economy. Once most of your workforce is sick or are dying, then you have to begin to look into new workforce, which could lower your own country production as far as the human resource cost is concerned. Increase national or outward migration. About 2/3 of Africa is trying to seek another country to go to. Most of the kids in Liberia now are applying for visas to go to Dubai, Turkey, and I'm told there's another country that just got on board. I think with that, Kareska, I don't know where was that. But most of the young stuff are trying to leave Liberia, because of the challenges they are faced with, whether it's from natural disaster, whether it's just the current economic constraints, but they are leaving, and that is going to, in the future, drain our country. Because particularly a country like the United States, most of the Africans who go there and live there for over 5 years will never come back to live. I can guarantee you to come back to Liberia for me was years of decision making. You live a lot of convenience in the United States. When you are back home in Liberia, you see a lot of economic challenges that will always remind you to run back to the US. So you have to be really, conscious and determined to be able to stay home in country when you have the opportunity to go back out of continent to resource countries to go and get educated. Because remember, the intention of those resource countries like the US, Canada, and England, they are all trying to steal African brains away. So they give you all of these perks and better scholarship and education. And once you graduate from college, biomedical engineer, they say, listen, you don't have no job in Africa for this position, so you can stay right here and we'll pay up your student loan and you can go to school. So that's a way of entrapping you. And eventually when 10 professionals become scientists or engineers and never come back to Africa, that's 10 scientists Africa had lost. So all of these are factored into the major challenges and how environmental health and constraints, economic constraints, and sometimes even poverty are highly working against the interests of Africa on other stuff. Africa has had a lot of challenges with managing our natural resources, and we now are experiencing a lot of difficulties when it comes to environmental health. To be one of the richest continents, to experience that, we have pretty much about 60 to 75% of all of the natural resources on Earth. Africa, is challenged with too many things that exposes us to environmental exposure. Environmental health challenges. And in like I mentioned on the previous slide, the population in Africa is nearly 1.3 billion now, which is going to be increased in the next 10 to 30 years. But the ages below 35 years old, and I'm sure we have a lot of those on this call, are those people who will be the most affected and the new generation that will have to constrain and fight with most of these environmental public health issues that will be unrolling and affecting us in the next few decades to come. So it is necessary, if I may advise, and that would be in my recommendation later, that a lot of you begin to see reason to venture in public health. And by my closing slide, I will personally tell you how public health professional career has contributed towards the leverage I have to be able to take any job at my will and pleasure, because public health provides you endless opportunities to be able to work in any sector, from politics, public administration, to whatsoever with a public health degree. So, those are just issues we want to talk about. But particularly, we want to list out the opportunities that provides for African young people, for innovation. Now we are talking about solar panel. We are talking about solar energy as a, remedy to greenhouse gases and, to the reduction of degradation of our resources. if we can work to reserve our renewable energy, and we can improve our energy by solar production, there'll be a lot of solar companies coming to Africa to begin to use. Somebody even talked to me the last time I was in the US a couple of weeks ago, that, whether I could provide them land to grow solar farm. And these guys are trying to plant about 100 acres of my land with solar panel and sell the electricity to Liberia and Sierra Leone. We are still on negotiation of that. I'm looking at the environmental aspect of it, because to be able to plant 100 acres with solar farm, you have to cut 100 acres of trees, and when you have a solar farm, you have to clear that spot such that the sun ray can be able to directly affect the solar panel for it to produce the kind of electricity they're trying to generate. So I'm thinking about putting cocoa and coffee on my land so that becomes a kind of reforestation. So it's a dilemma for me. What do I take? Do I take the solar panel, since these guys are trying to augment the kind of power production for Liberia, or do I plant my cocoa and coffee to save the soil and continue to reforestate the land? So that is an innovation opportunity that has come, but it also comes with challenges and the ability to think. Job creation. Most of those new investment opportunities will create jobs for the African market. As we can see that our population is aging, most of the folks who will be looking to be trained to benefit these jobs will be young people. If you manage the environmental opportunities well, environmental health opportunities well, we could definitely explore increase in jobs based on new technologies coming to Africa, based on new innovation, and even you all young people could be benefiting from those. Tourism, I put tourism on that list because our ecosystem tourism is a major stuff. In fact, as I speak to you, particularly in Liberia, we have people coming from England now and from South Africa to come here to Liberia to surf. Our ecosystem and our water surfing here in one of our counties called Grand Cape Mount is one of the best in the whole wide world. I mean, folks are coming from all over the world to come to ride the wave there. So we need to create and protect that ecosystem so that tourists can continue to come. And that's the way also we could create hospitality management for young Africans to get jobs within that sector. Research, there are so many cutting edge researches that pays a lot. There are new inventions, new diseases, there are new, solutions that a lot the world doesn't know about. So for young people to venture in those areas, provided those opportunities provided by, the issue of environmental health only provides opportunity for employment. Our opportunity include participating in trainings like you are doing today. I hope this workshop or this forum will provide you some background information that you could use now to build on to be able to continue your research, obtaining new skills and knowledge in environmental management and environmental health related issues. Other opportunities that provide is exploring creativities, at different level of project skills. I saw a guy who's trying to bring, an air balloon, a cube satellite. He took the balloon and created a satellite and put on there to manage, to average rainforest in Africa, predict rainfalls, do meteorological work. So those are some of the opportunities that we as young people need to get on, fighting for your voices and your contribution to be heard. A lot of time when you research and you put out a piece of document out there with your name on it, there are a lot of people who will be craving, trying to know the brains behind those hands or those writing on the wall. And if it is nothing else, just organizing advocacy group like this group is doing, which is why I feel really opportune to be a part of this presentation today. The Public Health Foundation is providing you all the opportunity to learn how to be advocacy in some of these areas: climate change, global warming, water scarcity, air pollution. You could be your own advocates and do some research in those areas. So this provides a lot of unchanging opportunities that young Africans could take advantage of. For the recommendation and some solution, African countries from the greater theme should engage and continue intersectoral institutional disciplinary collaboration. What do I mean by that? We have the West African Economic Council, ECOWAS, Economic Community of West African States, that's supposed to be looking to see, and we also have the African Union. The African Union and the Economic Community of West African States are working together to begin to look at some of these issues as far as global warming, inter-countries trade, inter-country reforestation. I saw a lot of trees that were planted here in Liberia, that was planted in Guinea, that was planted in Cote d'Ivoire. At the time, the three countries decided they were going to collaborate on planting trees. So those are the kind of engagements that our regional countries are supposed to begin to look at. We should critically consider the importance of adapting climate change resilient resolution. We should begin to check to see how climate change is going to work with us and how we're going to work with our own inner minds to be able to prepare and protect our climate. Let's develop a national task force, if possible, to tackle some of the issues that we have jointly. A task force that will be able to go to Sierra Leone, for instance, to go to Nigeria, for instance, to see some of the challenges they have there, to work with the Sierra Leoneans and Nigerians and Liberian government into setting up standards and operation procedures on how our resources are managed so that it does not affect our environmental and our environmental health. The young people particularly should take advantage of existing opportunities. There are a lot of opportunities out there for job training, scholarship, and so forth in various areas with the United Nations Environmental Protection Agency, the United Nations education funds, the United Nations global management. All of those places have some internship and vocational programs that you all should begin to look into. CDC, which is the Center for Disease Control, they also have public health opportunities for young people to begin to look at. So use your available resources to actually explore opportunities that could come to help to build your capacity for the near future, because when the future ensures, we're going to be depending on you young people to move us to the front of the line of what it is. This is some of our artisanal mining activities going on in Africa. This picture particularly comes from the Congo. There was an explosion of gold, and the whole village just ran and started digging all over the place. And this is what you see. But I can guarantee you, after the next few months, because of how this place is partitioned, the rain is going to wash most of this soil away, and that could even bring a landslide, if not erosion, over to us. So, I will stop right there, right now, not trying to take most of your time today, to hope that what I have presented, may have made some sense to you to be able to ask some questions if you have any for me, moving on. Thank you very much for the opportunity to share this platform with you.
I don't know. It was really great, a very good presentation. Thank you very much. So now we open up for questions. If you have questions, you either write in the chat box or you just raise your hands and we will unmute your mic for you to ask a question. Thank you very much, Sir Kennedy. That presentation was great. We enjoyed it a lot. All right, guys, just raise your hand and we'll unmute you. You can ask your question if you have.
Okay, thank you, sir, for this wonderful presentation. It was an honor having a Harvard University student within our mix. And my question is, you talk about overpopulation, especially in Africa, that in the next 2070, Africa will be having 2.4 billion. So what the strategic way you think that can reduce overpopulation in Africa? Thank you.
Mr. Barry, is that your correct name?
Yes.
That was a very good question, Mr. Barry. I am a public health professional, and I'm quite aware that overpopulation has a good and a bad side. So let's look at the good side of overpopulation, right? And I've been to Nigeria about 8 or 9 times now. In fact, I have a bunch of friends from Ekiti State, Kaduna State. I've gone to Abeokuta. I've stayed in Ile Ife. I've even met the Oni of Ife graciously that I work with some guys who are Nigerians, and we've kept that relationship since our school days. But I've seen the population in Nigeria, and I've been trying to compare the population in maybe, let's say, in a country like China or some Asian country. And I've been trying to see how the Asians are using their population in their interest, particularly like, developed countries. Population growth, the stuff folks are calling overpopulation, to be used wisely to actually increase your economic capacity. For instance, when you have population and you use that population wise, you could empower that population. Even 50% of your population, if they are middle income earners, your country will do very well. The United States is boasting to be the richest country in the world because you know what the United States has done? The United States have been able to build the capacity of its citizens and its residents to be able to get money. So everybody is able to buy some when they want it, even from the base of credit. So what that will do for you, population base, I think Africa needs the population. The good thing would be to be able to build the capacity of the population. Overpopulation becomes a problem when you have a lot of people who are unskilled and whose capacities are not built and whose ability to move certain industrial, are lacking. When you do that, then the population becomes a liability. But when the population becomes an asset, then I can almost tell you that overpopulation becomes nothing. Overpopulation becomes, an asset versus a liability. So I don't think we should be thinking on strategy to reduce the population growth of Africa, because to do that means that we have to design how the Chinese did, to say one woman can only have one child. And I don't think you want to bring that. That is, the human rights folks will be all over us. What I think we should do is begin to prepare ways that we as a continent can actually build the capacity to absorb the population as we grow into it. Because population, like one of my friends said, population is money once they have the capacity to produce.
Thank you.
Okay, so we have some questions in the chat box. I think you can check that.
Yeah, I'm trying to look at it. I'm trying to go to the chat box now.
Just stop sharing your screen, and then you'll be able to access it.
All right. There you are.
Okay. I don't know what the problem with Zoom these days. If you are sharing your screen, it becomes difficult to see other stuff.
Yeah. Let me see. So Timothy is asking, Timothy Adinkolojo, I hope I'm getting this name right. He said, what are the present scholarship opportunities in environmental health? Timothy, there are scholarship opportunities with the National Public Health Institute in your own country. And, most of those scholarships are international. Unfortunately, though, most of us in Africa will skew the scholarship to benefit only people we know. But what the Disease for Control and the National Public Health Institute in the United States does is they share scholarship opportunities with, collaborating countries that are all part of their scholarship plans. And when they do this, this is stuff because they're trying to help African countries to build their own, capacity to see how they could work on, sharing manpower and sharing, human capital and human resources. For instance, we are sending one of our staff to the U.S. next week, to do gene sequencing, to do DNA sequencing RNA sequencing from the positive samples that we are getting from the COVID patient. That sequencing will help us to understand what kind of diseases what variant of the COVID we currently have in Liberia. You know, we are speculating that there's the Delta variant here. We have the Alpha variant, which has been confirmed, but now we are hearing of the Delta variants. But we have not been able to actually prove the variant is it. To do that, you have to do a sequencing of a collected specimen, you know, sample from one of the cases that we have to work with. So we are sending one of our staffs, one of the scientists we have here at the National Public Health Institute, to go up to the United States to work with the CDC and NIH to be able to sequence that. So those countries understand that there's going to be collaboration between African countries and their countries in pandemic and epidemic management and surveillance tracing and surveillance prevention. So what they do annually is to provide scholarship opportunity for honor resource or developing countries. When those scholarship opportunities come to our countries, our administrators of them tend to only put people on the scholarship who they favor or who they know and whatsoever. So it becomes difficult for me to refer you to a particular source in country that has those kind of opportunity. So the best you can do is to look on the NIH, which is the National Institute of Health, or the CDC, which is the Center for Disease Control. You can begin to look there to see, even with the United Nations, to see what scholarship opportunities they have. I know of the United Nations scholarship opportunity, most of it that you have to pay for your own, well-being while you are there. They don't. It's an unpaid scholarship opportunity. But other agencies and organizations will have scholarship opportunity. The next question that was asked was from Dawuda Sese. Dawuda Sese said, what are the challenges countries face and what obstacles are preventing assisting in improving air quality? Well, I'm not sure that I got Dawuda's question right, but if he's asking what are we as countries doing in Africa to prevent air quality, the challenges of air quality pollution for African countries, Dawuda, is mostly from industrial and waste management pollution. We do not have a lot of industrial pollution in Africa. You see, we're not doing too much manufacturing here. So the air quality may not be from some steel plant that is putting tons of CO2 out there. It may not be from the car production plant. It may not be from, it's mostly from, us cutting down our trees, deforestation, and cutting down the tree that's supposed to be providing and absorbing the CO2, and mostly from the garbage that we're putting out there and burning trashes. Most of the time we are burning trashes and creating toxic waste and burning them from pits. So those are the kind of challenges that we may have. And the way we can produce, we can be able to protect those as public health professionals is to set standard operation procedures that will provide country policies that will manage how you burn or get rid of your garbage, which is a proper garbage and waste disposal, for that. They say, Kaifa M. Sanon says, how can we stop water scarcity? Well, so water can actually be managed. Water management, water resource management is a very good thing that most countries need to get into. Because when you manage water resources, you can recycle water. I stayed in Netherlands for some time. Netherlands actually does not have water, period. It is the lowest part of Earth. It is sitting, Netherlands actually sits below sea level. So all around the Netherlands is only salt water. What they are doing though, is they are taking the very water they are using in their household and recycling it to use it again in their household. So they are recycling water and actually reproducing water. They just begin to alkaline salt water and to use it in household. So right now, they are removing the salt from the seawater and they're beginning to use it. But we may not have that kind of technology in Africa to do that. So the best way we can protect our waters in areas with water resources is to make sure those resources are not abused. Instead of putting mining and heavy metals in the water, we should protect our waterways from people who want to do that, and we should harvest rainwater. I just told you how Liberia has a very heavy rainfall. Sierra Leone may probably have the same because we are on the same coastal belt. Guinea could also do that from certain time. They have rain certain part of the year. So you could harvest rainwater and you could use the rainwater and recycle the rainwater. So those are just some of the ways that we could use to do that. Then Dawuda said, what do you think we can do to detect water pollution? Water pollution is simple from our end. Most of the trash we produce go right back into the river beds, go right back into the ocean, go right back into even our recyclable water. Most of our wells are open, Dawuda. We see we're walking around with open well. So like you rightly recommended, we need to do some more water analysis. But in the process of doing those water analysis, we need to be able to protect the water sources. Make sure that we defer all garbage pollutions or all garbage solid waste management away from our water sources. Managing our water sources will help us a lot when it comes to our water pollution and water pollution management. Kaifa said, why is study on environmental health is important for the human assistant? Oh, Kaifa, that's a very good question. Environmental health manages how the environment affects your health. So if you are studying environmental health, you are going to be one of the professionals who are going to be working along with various industry. And they have environmental health professionals almost in every industry on earth. I mean, even the people who are doing construction management, you have to see environmental health, environmental engineers to go there to assess their water, their whatever mixture of chemicals they have, what concrete they have. So every employer are supposed to have an environmental or occupational health specialist embedded on their staff to be able to guide them in making their planning for future and their program development. So I think this is, this is good. And somebody is asking me to share my email address. I will definitely do that. I will share my email address with you now. My personal email is at pekay40@yahoo.com. Feel free to communicate with me through that medium. I check email regularly and respond to them also on the timely basis once I have the opportunity to do that. So I just share my email address is pekay40@yahoo.com. I hope I am getting most of the question solved here. I still see somebody hands up. I don't know who hands is this.
Let's take him.
Yeah, I want to ask questions.
All right, Haruna.
Yeah, actually, I have 3 questions for the Virgin. And my one question have to do with, you spoke on many things about pollution, like air pollution, flooding, and so forth. But you haven't talked about noise pollution. But I don't think if noise pollution really affecting our country. So my second question have to do with, you spoke on Dow biographic. Let me see. Okay, you spoke on Dow diversity, and how do you think we can maintain Dow biography in the continent Africa? And my last question have to do with, you spoke on scholarship, the impact of scholarship, where people move from Africa continent and go to the Western world to acquire education. And when they acquire education, the Western people take them to work there without coming in our country. And you are encouraging the youth to get on scholarship and go to the Western world. Do you think these people will come back to Africa to build or develop? Thank you.
Barry, my man, you are question box. But I'm glad that you were not sleeping during my conversation. This public health thing can be really boring, but your question is posing to me that you were an active listener. So you talk about noise pollution. So the average noise per decibel that anyone's supposed to listen to on a continuous frequency is 10 decibel. And you can do the research on the average noise per human consumption. In Africa, so in the US, before you start a nightclub, You know, the nightclub is one of the loudest places that I have been. Before you start a nightclub, you will have to get a certification to start a nightclub. And then what they will do is the environmental department will come and look at your equipment. And then the environmental department will review your walls. Your wall has to be soundproof. In the US, when you have a nightclub, when people are standing outside the door, they are not supposed to hear the music. I don't care how loud the music is, the music will only remain in the building. So before you build a nightclub or set up one, they have the environmental engineer who comes and does the full-fledged assessment. I think it's 32 points assessment. They'll be looking for 32 things. Once you pass all of those, they give you a certificate. When you put the speakers in your nightclub, the speakers have to be a certain frequency so that it does not produce over the 10 decibels per square into your ear, because continuously that could perforate your eardrum, or it could make you to, you know, not hear well. And I was telling this a joke to one of my friends in Liberia. You know, we don't have noise control in Liberia. Anybody just make any noise they want. The churches put the big speaker outside and just blow it in anybody's ears. Generators are sitting everywhere and beating all night. So it turns that Liberians don't speak low. We scream every time we talk. So one of my friends was asking me, Paul, you are right here. Why are you shouting? and I was quick in telling him, listen, I'm shouting because I'm used to noise. And even in the absence of noise, I figure I'm in noise. So most of the time I have to shout. But you know, Dauda, you know, just to answer your question, Barry, I think our environmental protection agency will have to pay a keen attention to noise, because noise management actually affects people. And I didn't list that on, you know, our presentation, because if we want to list every impact of environmental health on people, we're not going to leave this room tonight. You know, so we just threw the big things out there, which is air pollution, which can happen at a bigger scale, which is, you know, water pollution, which can come and kill you in an instant, climate change. You know, those are the big ticket items we threw out there. But, you know, noise management, noise pollution is also an environmental health issue. You know, you are right. If it is not managed well, it could escalate. But it has not come to the concern where people will be falling down and getting sick because somebody came in and made noise in the environment. So until it reaches that extent, the best we can do is to put regulation and policy like city ordinance, you know, laws, which will help to manage those. And your second question about how do we protect the biodiversity? Stop cutting your trees. Stop allowing the logging companies to come and take your trees. Maybe we should stop putting the big fishing vessels that are uncontrolled into our water, and they are catching all of our fish and driving the ones and throwing dynamite into the water and disturbing the water space. So those are the kind of things that, but it comes back again from the policy perspective. From the national policy perspective, our countries have to be in a position to make policies that will protect our environment. Because if the country does not make those policies, you as the individual public health professional, the most you can do is to set up an advocacy group that will be going around telling people what to do, what not to do. But most of the time, people don't easily do what you tell them not to do if they are not policy enforcement. So that's where these groups like the Public Health Forum and other intellectual groups will have to lobby to see how countries' government can begin to take this thing seriously so that policies can be made to help facilitate some of the good works you guys are doing. And your last question was, we are encouraging people to go out to get educated. Well, seeking opportunities to go out to get educated does not mean that you as a person should not have the integrity to come back. I went to the United States and got educated and came back. I am a public health professional with a clinical management program. I have degrees in physician assistant. Just as a physician assistant, if I decided to live in the United States to practice medicine, I will make not less than $120,000 every year. That's about $12,000 United States dollars a month. But I left all that money behind and came to Liberia where I make less than half of that money. Now, in the US, there are a lot of people sitting right in my zip code who are medical doctor, physician assistant, occupational therapist, to the extent that if I stay there with my degree background, I'll be completely insignificant. How do I offer these skills that I have into a country that have the abundance of those skills? So I sat and thought, as a person with integrity, to come back to my country where they may not have this kind of skill set for me to continue to contribute. Right now, I am on the incident management team of the COVID in my country. I mean, just yesterday, I have to set up the testing lab. I make sure that we are processing samples now on the expedited rate. I could not have done that sitting down in the United States. So I see that every little contribution you make to your country that is human resource constrained becomes a good resource. So that in itself should be driving you as a person to come back home. You don't have to let anybody to convince you when you have the opportunity to go away. You see your people are dying every day. You as a person with character and gone and getting opportunities to bring back those opportunities to extend to those people who may not have the same privilege you had to travel. So that's all I have to say about that. I don't see any way we can be able to constrain people when they go to the US or developing countries to tell them to come back. You cannot force them back. They have to make this conscious decision as a person to be able to come back, because I can guarantee you it is tempting to go to Europe and to go to America to live. Chances are you may never want to come back. Thank you. I mean, I hope I was able to try to resolve, to respond to some of those questions that you are throwing out there.
I have a question.
Okay, Enoch, you can ask your question.
First of all, I want to appreciate the presentation from Dr. Paul Kennedy. Actually, you've explained exhaustively on but my question is just a concern. Our African countries have got the capacity to ensure that environmental pollution is something to be buried, but now the young men and women who are capacitated intellectually, they are not being given that opportunity to provide their expertise in ensuring that there is that environmental conservation. Now, you being an intellect, what mechanisms are you putting in place in conjunction with other intellects across African continent to ensure that the young generation, young professionals are integrated in the government policy framework in terms of policy, in terms of policy formulation in relation to environmental health? Then number two, you've talked of Africa having 60% of natural resources on Earth, and yet Africans are Africans are the poorest people on Earth. Now, you, one of the experts and intellect, what are you putting in the working closely with the experts to ensure that we exploit the natural resources that the African continent is endowed with to better the living standards of Africans? Thank you so much.
Mr. Enoch, your question is more political than environmental, but when you do public health, you also do health policy, which makes you a politician. So we are all politicians on this platform. But I agree with you that so the first thing I think we should do is to begin to include the younger generation, 35 years and younger, into policy advocacy, in policy making, in policy development, in policy implementation. The reason why that is necessary is this generation of 35 years and younger are the future generation. So when you get them involved with making policies, with making advocacy, with developing and implementing policy, they are going to be on the table where policy is making, and most of the time they're going to be included in the policy making process. But let me tell you what's happening in Africa. It's not as easy as we are saying it in Africa. You and I best know that most African governments really do not include young people in their management. With us in Africa, it has to be, you have to be 65 years and older before people think that you have the ability to make sense in management. Let me tell you a joke. In 2020 of December, I was one of the candidates that ran for Senate in my country, in Liberia. I ran for the national legislature to serve as a senator. And do you know that people decided they were not going to vote for me because I was too young? Come on, man. Do I look too young to you? But they have this school of thought where you have to be very old.
So
You know, you have to be very old before they give you state power. So that itself is negatively producing to how we incorporate young people into policy development. And as long as we do not incorporate young people to bring new fresh ideas, to bring new innovative things, we're going to have the same old way of doing things, which has been the way Africa has been doing things in forever. Now we are in the 21st century. We are in 2021, and Africa is still having all these huge challenges of internet, of electricity, of roads, of all of these things that the West is taking for granted. You know, all because our managers, the people who are managing us, are still living in the arcade sense. They are living in the 1950s, because these are the people who are running. You know, there are older people who are 78 years old, 75 years old, running our countries. You know, tell me, what can a 75-year-old man tell you now? He's not going to tell you of the real time. If you even put a computer before him, chances are he's not going to be able to manipulate that computer to give you what he has. So we need to work to do that. But my brother, the challenges are, if you are not in the system, it is difficult for you to make any appeal for the government to take you. So although I agree with you that I may have some little experience and I could be able to guide the country into writing policy and making the right arrangement, I've written several policies that I gave to the Ministry of Health that nobody took. I've made several policy recommendations, but because I'm not in government, nobody listens to me. So one of the reasons why I was fighting to get into government, and I was fighting to get from an elected position perspective, because I did not want to be the puppet of the president. You know, if you are not elected, if you are appointed by the president, you serve at the will and the pleasure of the president. You disagree with the president, you don't have a job. So I have a big mouth and I have a big heart. So, you know, that's why I was really trying to get into government from the perspective of an elected position. So there's not much we can do, you know, as far as individuals who are technicians, who are professionals, trying to make any recommendation to these politicians. The politicians will not take what you are telling them because it undermines their longevity into power. And for them, it's about holding the position and just sitting there and doing nothing with it. I hope I was not too political, but you started the politics, so I'm all for it.
Thank you very much, sir. That was great. You still have time. I guess there are more questions to come. So, Enoch, do you still have a question?
I'm not a politician, but another thing that I actually had raised a big concern in terms of policy implementation. There are very nice policies within our governments, but how to implement? People are capacitated, fine, but now the process of implementing these policies are very big challenge. Like on the issue of plastic waste management policy, it is a very nice policy. Like in our country, Kenya, the government had banned usage of plastic bags. But even right now, as I'm speaking, in the kiosks around my shopping center, there are plastics being sold. And I think this is a problem with our African leaders. Yes, they formulate policies as the doctor has said, but the problem is lack of incorporating young expertise in implementing these policies. I think there is that void that needs to be looked at in a critical way so that we curb this issue of environmental pollution. That's what I also wanted to add on. Thank you so much for your time, guys.
Thank you, Enoch. Just let me not overlook Fanta ability. Fanta asked a question that asks, what is the function of government in Liberia when it comes to having safe drinking water for citizens? That was Fanta's question. So Fanta, in Liberia, The
Charles, I get
government.
to you? I get this one.
Hello?
One level, maybe.
Hello?
Oh, anyone there?
Princess Bolo, please mute yourself.
Yeah, sorry. I mean, I was responding to Fanta's question. So Fanta, in Liberia, water management is given to an autonomous agency called the Liberian Water and Sewage Corporation. The Liberian Water and Sewage Corporation is an autonomous agency created by an act of legislation to manage all of the Liberia water infrastructure, making sure that surface water are procured and managed, making sure that groundwater are purified and kept, making sure that water distribution is equitable in every household, making sure that our water surfaces are secure. That is the responsibility of the Liberian Water and Sewer, and that organization is managed by a managing director. In fact, just recently, the United States government constructed a 5-kilometer pipeline that will bring water from one of the in-source water intake into the processing plant for the water and sewer. So there are a lot of partnerships from the World Bank, from the Millennium Challenge, from the European Union that are helping with the Liberian water and sewer into managing its water infrastructure and building their capacity. But to answer your question, water here particularly is managed under an organization that has the sole proprietorship in managing and regulating our water sources in the country. And that's how far. So every issue about water, you go to the Liberian Water and Sewer, and then the national government has a Liberian Water Commission that oversees the Liberian Water and Sewer organization. So the Water Commission is a representative of the people that are kind of like board of directors or board of managers that are keeping their eyes on the functionality of the Liberian Water and Sewer Corporation. So our water processor is very managed, but like any other system in the country is very highly constrained. Some parts of Monrovia up to now even still don't have water, but we have the infrastructure in place on paper. It's just that, like Agnoc said, the challenge becomes with the implementation and the enforcement of it.
Thank you very much, sir.
I have a question.
Okay, after you, I'll ask my question too.
Yeah, thank you, Mr. Kennedy, for the brilliant presentation. Mine, I've been due to the area of waste management, which have to do with the environment, waste, especially solid waste management. In Liberia, personally, looking at our country, especially the area of red light, and then the driveway, Somalia Drive, going to red light, our communities, dwellers, people who live within the community, take the dirt from the community and bring it right in the road and trap it in the water flowway. And this is harming the country and harming the citizens, because if these places are polluted and dirty, the diseases come back to the country and to the citizens. So I'm thinking, how can the National Public Health Institute work along with the health ministry to be able to reduce the waste management program and to be able to reduce the waste management and help improve good hygiene sanitation, because looking at the way the COVID-19 now is coming back with a new variant. So I don't know how you can look in that direction, sir.
Thank you very much. Who was speaking? Ebenezer?
Ebenezer, sir. Yeah.
Okay. Ebenezer, I am no stranger to the areas you're managing about, but you are even going far as Relay, right on Central Street, right on Front Street. There are part of garbage collection there on a daily basis that sometimes even impedes the traffic movement. And you know the way it looks like on Front Street, for example, they put a garbage right there under the hill when you come from Central Street on the top. When it rains, the rainwater comes down and take all of the pathogen and put them through waterside and scatter them all around on the street in Monrovia. In Liberia, the solid waste management has been given to the city corporation, unfortunately. The city corporation is the group that is responsible to regulate all of the solid waste management. If you live in Pittsburgh area, you see the PCC that's running around and doing garbage collection. If you live in Monroe area, you see the MCC is running around doing the same and so forth. What those cities corporations are not doing, they are not putting in place the appropriate policy enforcement to ensure that people are doing the right thing on garbage collection. You saw that when Mary Bro was city mayor. If you live in Monrovia when the Mary Bro was city mayor, and you live in Monrovia now when the Honorable Jefferson Koji is the city mayor, you see a clear distinction in the two administrations. Because Mary Bro's city management and waste management was strictly about enforcement. If Mary Bro gave you the garbage bin and you had to put dirt in there, you cannot waste the dirt outside of it. But this administration, as far as the one Honorable Koji is running, I think it has a different approach on how it is managing its waste. Now, the infill can only advise on that role. We really don't have any oversight as far as how the country structure is on solid waste management, although it can become an environmental hazard and it can even lead to a rise in other diseases, like Lassa fever, other skin and most predictable waterborne diseases. But at the moment, the government functionality are separate, and while trying to interfere from the policy standpoint, will make it look like you are only trying to do somebody else's job, and a lot of people don't like that in the country. But as far as making the recommendation, I work directly in the Director General, Madam Jean McCauley's office. She's a very open-minded person, and she's very innovative, always trying to bring new ideas for us to work on. Maybe Enfield could begin to see how we could complement the efforts of the city government, both in Pittsville City and Monrovia City, to see how we could manage, talk about environmental health and environmental protection, and work with the EPAs to see how they could instill policy that will actually help to manage the environmental and solid waste management system so that it does not create an adverse effect that could affect the environmental health. But at the moment we are faced with a pandemic, which we are currently trying to manage. That is one big issue. Folks who are supposed to be wearing face masks are wearing the face mask under their chin and they put it right here to their nose. So that is a major challenge right now that we are trying to get that. Once that comes down a little, then we'll begin to step our band into occupational health, fire management prevention, natural disaster management. We'll collaborate with all these sectoral groups to see how we can bring, a unified force because we are all government agencies and entities. I don't think we should be doing separate things. We should all have a direct focus goal on how we can implement things to improve the health and well-being of our people. But that was a very good issue. I wrote it down. In some of my lecture time, I will have that deliberation with the Minister of Health, Dr. Jala, and also with Madam Jean McCauley, so that we see how we can begin to look into the waste management issue. But thank you very much. That was a very good question, Ebenezer.
All right. Thank you very much, sir. So I have a question myself. Firstly, my name is Musa Hassan Kuruma. I am the founder and director of Popular Health Foundation of Liberia. And we want to say thank you for joining us. So my question is, are there any opportunity, like funding opportunity for youth organization in field? Like, for example, we have some projects to undertake in Liberia, but we find it difficult to undertake them because we could not get a hall. When we went to some places to rent a hall, they told us we should pay like $100 US for a day, $200 for 2 days. So it was kind of difficult for us to undertake them, and we were forced to do them online. And most Liberian youth, they face difficulty when it comes to online stuff. Like, for example, this training, we had over 200 plus applicants, but they all cannot attend due to internet. And some of them were even begging us to do the training on WhatsApp, like WhatsApp messages, the training. And we can't do that because they don't have access to, they can't access Zoom because of internet problem. So we find it very difficult to undertake some of our projects because of these stuff. So are there any funding opportunity at field that we young people can be able to present our project for funding or for partnership with the National Public Health Institute of Liberia? Are there anything like that?
Thank you very much, Mr. Kroma. Musa Kroma.
Yes.
To be honest with you, I am very new. In fact, this is my second week at MPhil. Before MPhil, I served as the director for health and environmental management with the Millennium Challenge. You know, the Millennium Challenge just closed down, and I took a vacation to go to spend some time in the US to visit friends and families. So I came back and I just started. So I am also still learning the MPhil system, but I can guarantee you almost that there are definitely opportunities to come. Like right now, I'm sitting down thinking about, you know, revamping the contact tracing and throwing people out there to do public awareness on proper mask wearing. So I will be hosting that conversation with, you know, the DG, the Director General, to see, you know, how we could involve public health institutions, public health organizations like yours to work. To say there's money sitting down where we're going to give to you for sponsorship, I am not sure that money is there, but maybe we could create an opportunity for you to come to do some work and to get money that you could use to do other programs with. That's not a giving because, like I said, I'm just getting into the system. I barely know my way around. So I need to talk with her to understand what are the opportunities that young people have, especially with organizations like the Public Health you know, Foundation that we can use. Another thing is that has to do with public health training. I can't speak of it now because of the pandemic, but those are things that you can reach out to me to see whether the conference room at MPhil is available. As long as that thing has to do with public health, you know, in our country and other places, we could definitely see how we could, you know, facilitate and bring to board the little resources we have to help you with your work. But again, I'm the new kid on the block. There are a lot of things that I don't know, I'm learning. So, you know, let me ask some questions and let's definitely keep in touch for me to see how I can provide you the answers I find in the questions I go to ask.
Sure. Personally, I would love to network with you for future stuffs because the fee you took is the same fee I want to take in my educational journey. So I would really love your counseling and your mentorship. I will send you a message on after the
Absolutely. I mean, my email is there, and I will put my WhatsApp number. I will put that also online. You know, those of you who don't do email very well, you can WhatsApp me. Because I'm not in the US, if you call that number, it will not go through. But if you add me to it on WhatsApp, it will definitely work. That's +1 202 290 4670. That's Paul Kennedy's WhatsApp.
Are there no other questions?
I have question.
Okay.
I was told that I was going to be. I was told I was going to be here for 1 hour.
All right, sir. If we're just asking questions because we thought you still have time with us, but if you have other schedules, we can just take the last question and comments, and then we just close up.
Absolutely, we can take 2 more questions because you know I got to jump on another meeting.
Okay, thank you very much.
Yes, sir. My question have to do with the marks aspect in our country, Liberia. And you see, many people are sewing the marks, selling on the street for almost 3 to 4 days. Do you think that this prevention for us, whether in our country, Liberia?
So your concern, who was asking the question?
Barry.
Oh, hey, Barry, your concern is that people are sewing the mask and hanging it in the street and you're buying it and wearing it, whether that mask is safe. That's your question?
Yes.
Yeah, but it's the same like anything. The people are hanging clothes in the street and you're buying it and wearing it. The people are selling banana in the street and you're buying it and eating it. So all you got to do when you buy the mask, don't just wear it. Buy it and wash it clean before you wear it.
Okay,
Okay, thanks.
hello.
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 There's no question as you asked.
Hello.
There's no question as you
I think
asked.
Ebenezer has a question, right? Ebenezer.
Yeah, Musa, it was just I've been due to the area of deforestation where deforestation where Mr. Kennedy talked about deforestation in the presentation. Now Liberia there are a lot of companies that are taking lessons to do let's say cutting down the timber. So what I want to understand, because companies that are doing this business now, I don't know how is the government working along with them in order to make sure that there's assuring or ensuring programs that if they are cutting down those trees, they will be able to replant. I don't know, is there any policy placed down for that?
Yes, Mr. Ebenezer, you are asking, right?
Yeah.
Yeah, I'm sure because the Liberia has the Forestry Development Authority. Liberia has the Community Forest Management Group. Liberia has another group that is for forest regulation. But those groups are responsible to ensure that all of the concession agreements signed. Yeah, I'm hearing myself. Somebody needs to put themselves on mute.
Ebenezer, please mute yourself.
Can you all hear me now? All right, yeah.
Yes, we are hearing you. Mohammed.
Yeah, it's much better now. But what I was saying was that so all these groups are to ensure that the forest is appropriately regulated so that when concession agreement is gone through, these forest agencies or forest entities can be able to bring back some social corporate responsibilities, like making sure that whatever tree they're cutting are only trees that are supposed to be cut, because before you cut the tree, the forest development authority is supposed to come and invest, survey the whole place, understand the kind of trees that are there, make sure that you are not cutting immature trees, and all of these needs to be appropriate so that at the end of the day, that you are not harming the forest, that you are cutting only the trees that are allowable for you to cut. So I think there's a mechanism in place through the Liberian Forestry Development Agency. The Forestry Development Agency is a sole authority working in collaborations with other forest groups like the Community Forest Association and even the town and the county that has the forest, to ensure that people who are coming there to manage forests are within the lines and the purview of the forest development laws.
Okay, thank you very much, sir. Mohammed Bala said he has a question. I don't know if you can take this.
Yeah, I will take Mohammed's question now, and then that would be the last question I would take. And you can email me all the questions or WhatsApp me all the questions as we go on. I can definitely lift up. I just posted my WhatsApp number. It is +1 202 290 4670. So you can reach that to get that to reach to me. I will definitely respond to your questions that I have the answers for.
Mohammed, you can ask your question.
Yes, sir.
Yes, Mohammed, continue. Mohammed Bala.
Yes, I just want to discuss. Is there?
We are not hearing you.
Can you all hear him?
No, we are not hearing him.
Yeah, I think he's having some challenges with his internet. But Musa, look here. I put my email address, and I put my WhatsApp contact. What I would recommend you to do is to create a WhatsApp group with everyone who wants to be in a WhatsApp with the Public Health Foundation. You know, the Public Health Foundation has a working group WhatsApp. You can just leave that open so that anytime we get news, you know, articles, you know, maybe even opportunity for scholarship, we could just drop it in there. That's how I'm a member of the Mandela Washington Foundation. I'm a member of the Howard University Alumni Association. All of those groups have WhatsApp groups that we keep in constant contact with. I think that would be the preferable way. Then for each one of you to personally, you know, reach out to me. Let's just create up that WhatsApp group. You know, that could be a very good medium for us to continue to stay in touch. You know, I hope I was able to provide more time for you all. I really enjoyed this presentation. I hope to come back again sometime when you have the opportunity. Please let me know. I'm not trying to take Dr. Blama's job away from him.
No.
But Blama is a very extraordinary gentleman, and I'm very honored to share the same platform with him. Yeah, you know. So thank you very much, and we'll be looking forward to seeing you in person, since most of you live in Liberia.
Thank you very much.
Yeah,
sir.
most of them live in Liberia. Thank you very much, sir. We are very much glad to have you here, and we can assure you that we will call you next time, because today was exceptional. Like, I don't know. I didn't expect it to be this much educative. So thank you very much. We will send you email to official email account for the slide. We also need a slide to send to the participants, because most of them were asking for it. And we will send email along with some photos from today. Maybe you want to post them later. We will also need your LinkedIn, your Facebook account, so we can tag you in the post. Maybe you want to share. So thank you very much. And we are very glad to have you. And I personally, we wanted to be a mentor. So that I will come to you.
Yeah, thank you very much. You know,
comment.
For 4 years, since 2012 to 2016, I served as an assistant professor at Howard University. So I was also a mentor of a lot of public health students. You know, I was an internship coordinator. So whenever you guys need any advice, you know, that's why I'm recommending the chat group and the email. You can utilize that. I'll be able to make myself available as, you know, as much as necessary.
Sure, we will do that.
Thank you.
So guys, please, mute yourself. We will take two comments. One from me, one from people.
Yes.
That will close. Two comments.
Yes.
Close. Two comments. Yep. All right.
Yeah.
All right.
Yeah. Thank you very much, sir. Really enjoy your presentation. You know, I was lying down following the presentation when you was introducing yourself, and you said, I'm a Harvard University student, and I wake up and sat down, because that's have been my dream school, and I've been following Harvard University student. Most of them are over to us. So thank you very much, and glad to be Harvard University in the midst. Thank you very much.
Well, thank you. Your dream should not be limited by anything. I'm from Sapema, a village in Bopolu. If anybody had told you that I would be an assistant professor at Howard, you would never believe that. So your dream is not limited. You should always fight to get wherever you want to go.
Sure. Thank you.
Yeah.
Okay, Fanta.
Yeah, let me say thank you so much, Mr. Kennedy, for the knowledge. It was indeed educative. We appreciate it, and we hope to get more from you, because as for me, I'm a public health student, and I won't hesitate to actually serve my people, because everywhere we are really suffering when it comes to health problems. So we appreciate you for your time and hope to see you again.
It seems like Fanta is the only woman on the forum, but I like gender.
She's not the only woman.
Oh, okay. The other women decided they're going to give up their rights to Fanta, right? But I appreciate the inclusiveness that Public Health Foundation is preaching. You know, you educate a woman, you educate a nation. I have 2 daughters. One of them is studying to be an environmental engineer, and the other one is studying to be a civil engineer at Maryland University in Washington, D.C. area. So it's my dream that we see a lot of Liberian women getting educated, and a lot of African women, for the most part, getting educated and getting involved. Running the country is not a man thing. We saw that President Salif did, you know, her utmost best. She had a lot of women inclusion. So you girls, you ladies, you African women should not shy away because some man is trying to bully you. You know, come to the table, bring what you have, because every decision we make, especially in public health, grossly affect the women population. So I'm very proud and honored to be sharing this forum with people like Fanta and the rest of the ladies that we have on this group. Thank you very much. And I'll be looking forward to, you know, talking with you again sometime. It has been a pleasure meeting all of you.
Thank you very much.
Have a nice day. Get ready for work on Monday.
Thank you very much.